Hello, hello. I'm so happy to be here. Before I introduce myself, I do have to say, who shows up to do a Facebook Live wearing a Barney t-shirt, right? Can you tell that my morning was kind of crazy? We're in the process of closing on a house and had to do inspection and stuff today, and this seemed like a good t-shirt to do house inspections in. Not so much for a Facebook Live, but regardless, it kind of makes me happy when I see it. So for those of you who do not know me, I am Carmen. I am a myofunctional therapist with a large global practice. So I bring this very important therapy to all corners of the world, to many countries and many, if not all, time zones. So I'm really happy to be here. Today, we are going to be talking about grinding. My new blog came out and it was titled Sleep Apnea and Bedwetting in Children. And so this is going to just take a little bit deeper dive. You guys all know that my path of passion is sleep awareness, sleep disordered breathing, really because sleep apnea kills people. So you guys, I feel like those of you who have been following me, you know that this is serious business for me. So what I'm going to be talking about today is grinding a normal part of life? Many of you have been told, maybe your dentist, your doctor, somebody has told you, that's normal. Oh, your kid grinds. Oh, that's totally normal. They'll outgrow it. Maybe not. So, you can probably already sense this. My answer is absolutely no. Without a doubt, grinding is not normal and it shouldn't be considered normal. So here's why I see this as a problem. Grinding is your airway crisis call. This is your body screaming for help. It's a survival tactic. It is connected to airway distress during sleep. And so what happens is we put band-aids on bullet wounds. Doctors see this as a couple different things. So I'm going to give my opinion here, and you guys are welcome to formulate your own. But any of you may have heard me tell you before, I used to be a dental hygienist, and I owned a temporary dental company, dental temp company. So I placed temporary people. That means I worked in hundreds of dental offices, and I have a very strong opinion about night guards. I know they have a time and a place. I know some doctors prescribe them to protect teeth, but I have also watched doctors prescribe them because revenue was low. I've watched doctors come in and prescribe them on every single stinking person that came in that day. So sometimes I have a little bit of an attitude of frustration about that. That is not saying that that's how everybody is. I'm just saying I have always felt like it's one or the other. The thing is, when a doctor tells you that you need a night guard, are they looking for the root cause? Do they understand why it matters to find the root cause? I want you to understand management does not mean resolution. So just because you cover it up and you don't talk about the problem anymore, that doesn't mean that it goes away, okay? Grinding isn't just a dental problem. It is not. There is much more to it. But the hard thing about it is that many dental practices, they give you the appliance and then away you go. So first I want to touch on, really there's a couple theories behind the grinding. So first is, obviously it's an airway crisis, so to open the airway. So I call this the CPR position. So when the head is tilted back and the chin comes forward, just the same as if you were doing CPR on somebody, you are taught to open the airway. So our body does the same thing. So it tilts. And oftentimes parents will say, oh yeah, my kid always sleeps like this. Or parents will send me pictures of their kid in a car seat and the kid always has his head turned. He's trying to get air. So we call this the CPR position. And what happens is the grinding is happening as the chin comes forward. So as that's happening, the grinding happens. The other thing is that oxygen is bad. And so some look at it like microarousal. So if the teeth keep grinding, then the body is not going to be able to go into that super deep sleep because there's either low or no. Apnea is complete cessation of the oxygen flow, and then hypopnea is just really shallow. Either way, they're not helping you get the oxygen that you need. So either way, you are fighting, you're in survival crisis mode, you're wanting air. When you do this all day long, your body is just trying to stay alive. This means chronic stress to your body, elevated exposures of cortisol, which are the stress hormones. And so your body just looks at it like you're just constantly in the fight or flight mode. This can increase your risk for anxiety and depression, which we all know is a huge problem. I myself, as a hygienist, I would see these people come in constantly, and everybody was on a med for that. So that's a biggie. It increases digestive issues and heart disease and weight gain, insulin resistance, memory problems. So I'm going to run down a list here. Let me pull it up. These are just some common things. So I want you to think about this and let it sit on your heart for a minute. Is this me? Okay. Sensitive teeth, gum recession. Do you have a sore jaw? Do you keep breaking teeth or crowns? Do you have troubles with your TM joint clicking? What about high blood pressure? Are you always exhausted? Do you have chronic fatigue, adrenal fatigue? Are you moody? Brain fog, poor memory, depression. I think I touched on that. I have a tickle. I got too excited talking. Aches and pains, low energy, bladder urgency. So that's a big one. And men, just to pick on you for a minute, this isn't your prostate. Just because you get up and go to the bathroom a lot doesn't mean it's your prostate. It's those the stress hormones giving you that bladder urgency, thinking that you have to go. I'm not sure if I touched on morning headaches. I think I talked a lot about the common symptoms. So if you're seeing these things, are you grinding your teeth? Okay, why? Why we need to know that. So is it a tongue tie? When you have a tongue tie, you physically have a barrier that holds your tongue down, so it's an obstacle in the throat. The tongue cannot be up supporting the airway when it's laying in your throat. So if you think about, like, if you tried to slide your foot into a shoe that was too short, like a clog, your heel's going to hang off the end. The same thing with your tongue. If it's held down, if your face is too small, if your jaw's too small. I mean, there's a lot of things here that get married together. One thing that I do want to touch on is how we make change with this. Goodness. First of all, we need to ask more questions from our doctors. I argue this all the time for you guys. You have to advocate for yourself. So dentists need to be looking at more than just the teeth and the gums. They should be catching things because it's reported that people see their dentist more than their doctor. So if somebody really has good dental care and they go to their dentist twice a year versus somebody who goes to their doctor once a year, and let's face it, not even a lot of people do that. So dentists, we are the agent of change. That the dental office, the dental hygienists are the ones that can make the difference. But asking your doctor more questions, just because you ask them, hey, is my snoring normal? Is grinding normal? All that stuff, and they tell you yes, you don't have to accept that. I mean, how many times are we looking for other opinions somewhere else? Your healthcare is one of those other areas. Your dental care is one of those areas. You shop around for the best price on a couch. Why wouldn't you shop around for something that really sits with you with your doctor? And I know it's hard because we need to trust these people. We need to advocate for ourselves. So I touched on that. If it doesn't sit right with you, if it doesn't feel right in your belly, get another opinion. We also need to demand stopping fragmented care. And so what that means to me when I talk to people about myofunctional therapy and how it's more about wellness than just your tongue tie or just a tongue thrust. What I do is help somebody live better. And when somebody gets to live better and have better overall wellness, they breathe better, they eat better, they exercise better, they meet their goals better, they are a rock star better. But that a lot of that goes back to sleeping and making sure they have oxygen, all of those things. They're kind of important. So when I talk about fragmented care, what I mean is inside your body, there are no lines that say, okay, hey, this is for the dentist to worry about. This is for your doctor to worry about. Another great example is allergies. Many of my clients will go to the allergist, and the allergist gives them pills, but they don't dig any deeper. They don't talk about mouth breathing. I can tell you guys that I used to take 4 allergy pills, and my allergist was happy to give me pills. But nobody ever said, well, how about your mouth breathing? Like, it would be better if you nasal breathe. So that's what I mean by breaking up that old habit of fragmented care, is so that we all start realizing inside your body, there's no lines that say, oh, no, this is only a dentist. I have worked with the dentist once that said, looking in the back of the throat is not my problem. It is. It really should be. And then we also need to start looking at ourselves as a whole rather than having a doctor for everything. So again, that kind of goes back to the fragmented care. If you feel like everything is just this little puzzle and nobody ever looks at you as a whole, that is a huge problem. Now for me, when I was transitioning from a dental hygienist to full-time myofunctional therapist, and I knew this stuff, I was able to look in people's mouths. I was obviously lifting and looking. I was cringing when a dentist came in and said, you know what, Bob, you need a night guard. Didn't look anywhere else. I was cringing when I would see clients come in with failed grafts where they had recession in certain spots, and now they had really severe sensitivity and of course a ton of frustration, and they had buccal ties and nobody had bothered looking at those. Every time somebody brought in a night guard for me to clean it, I lifted and looked. I'd get in their cheeks. I did an oral cancer screening, so it felt like it should just be part of that, which it was. So what I say to clients now when they come to me and they say, Carmen, my doctor says I need a night guard. I understand that there is a time and place for everything, but if somebody were coming to me right now and they said, my doctor told me today I need a night guard, I would say, you need to tell your doctor to dig a little bit deeper. Why am I grinding? Do I have a tongue tie? Do I have an airway crisis? Do I have obstructive sleep apnea? Do I need to see my doctor for a sleep study? Those are the probing questions that you want to ask. And so that is going to be really important. Another reason why I tell my clients, don't run out and buy a grinding appliance if I tell you you have a night guard, or if I tell you you have a tongue tie, because many of my clients never grind a day after their frenectomy. So it's not something that you have to rush into. Let's figure out what's going on, how we can have root cause resolution, and go from there. So what I say is find your person. So if this sits with you and you're saying, I have these symptoms, I have these concerns, I've been grinding my teeth for as long as I can remember, my face is sore, all of those things, find your person. And when I say find your person, I mean you can find somebody like me. You can look in your town, you can find somebody like me who works online, it doesn't matter. You have to find somebody who can guide you, who is knowledgeable in this stuff, and who can help you separate out the crazy from fact. There's many forums out there, there's Facebook groups, there's lots of discussions, that kind of stuff, and people who are giving opinions sometimes don't have the background. They have the anecdotal story, but they don't have the professional background, so I just caution you. But if you find your myofunctional therapist, that person you know, like, and trust, that person you can laugh with and be a goof with, because trust me, we're dorky, that person is going to help guide you, okay? So when I do a comprehensive exam, I'm going through all of those steps to help you understand if you have big red flags that say, hey, airway crisis, I need some intervention here. That intervention might be referrals to ENT. It might be referral to a sleep study. It might be a referral for a tongue tie, just different possibilities, but we need to look at you as a whole and understand everything. I've put up the link here also to get my free assessment tool. So at the bottom of any one of my blogs or this link here, you can sign up to get that. There are 25 questions. They're the most important 25 questions that I ask during a comprehensive exam. It helps you figure out if you have a concern. Then you can talk to me or somebody else. You can always start with a free assessment also. So in my world, ideally, start with the free assessment. See, download it, answer the questions, see what you learn. Then schedule a free 30-minute visit. It gives us a chance to meet See if you like me. See if you like the silly t-shirts I wear. If you like my personality, or if you trust my expertise, that kind of stuff. So we get to meet. And likewise, I get to interview you also to make sure that you're good enough to want to do therapy, that you're going to follow through and be a good client. Because I want successful clients. That's why I do what I do, is so that I can help you, not so that I can take your money. Then you can see what online therapy is like. So that's another great thing, is people meet me online. We do the free assessment and I answer your questions. We make sure that it makes sense for you to move on to a paid exam, because that's your next step. Everybody has to have that. But it doesn't have to be me. If this stuff resonates with you, or if you had a child who was bedwetting, make sure you go back and watch or read my blog today, because that's a big deal. I have had a lot of clients who, as an adult, have sleep apnea concerns that completely blindsided them. They had no idea, and then they go back and they realize that they wet the bed till they were 14, and nobody thought anything about it. Okay, so next week we're going to talk about what is meant by correct mouth posture. So I will be answering that. Lastly, remember, we're growing. We are small but mighty. I have the Tongue Tie and Myofunctional Therapy support group. I am on YouTube. All of these videos go there so that other people can learn. And feel free to share. Any of this stuff helps me get the word out for people so that they can be better. I will see you guys next week in the next Myo Minute.